Welcome to the Bay Area Academy's Microlearning on the Child Adolescent Needs and Strengths Assessment. The Child Adolescent Needs and Strengths Assessment, otherwise known as a CANS, is an assessment tool that engages the child, family, and network in a conversation about what's going on in the family. It engages everyone in a conversation about what's working well and what we are all worried about. It gives everyone at the table an opportunity to gain clarity about what is happening and then collectively determining as a team what needs to happen next. One of the beautiful aspects about the CANS is that it lifts up everyone's voice since it is a communimetric tool, meaning it is the tool that asks the group to find agreement about the identified strengths and needs of the family. The CANS is one of many tools used in child welfare practice that supports social workers in making good, equitable, and supportive decisions with families to determine next steps. At the heart of the CANS assessment are the 6 key principles. The 6 key principles are: 1. Items are selected because of its relevance to service or case planning. 2. Each item on the CANS uses a 4-item rating scale that translates into action or inaction. This helps us to focus on what we need to address now, what we should address later, or what we might want to keep a watchful eye on. 3. Each rating describes the individual, not the individual in services or supports. Since some services and supports can often mask the symptoms, we want to focus on what symptoms might be there if there were no services and supports in place. 4. We must consider culture and development before determining ratings. This will help us understand the child, youth, or family story better and provide more context for what we are observing. The more context we have, the better clarity we can develop about a family's experience. 5. Each rating is agnostic as to etiology and focuses on the what is happening versus on the why is this happening. This principle encourages us to focus on what we are observing now, what is happening now, and the impact of that to the child, youth, or family. 6. The ratings use a 30-day window when considering what is relevant to the child, youth, or family. This helps us to narrow our focus on the strengths and needs of the child, youth, and family today and the impact it is having now. The California Department of Social Services adopted the Integrated Practice CANS 50 as a baseline assessment measure to use with children, youth, and families. The Integrated Practice CANS 50, otherwise known as the IPCANS, can be broken down into 8 distinct domains. The Behavioral Emotional Needs domain. This domain identifies the youth's needs related to mental health concerns. The Life Functioning domain. This domain identifies the youth's needs related to their ability to successfully navigate home life, school life, peer or familial relationships, and general social engagement. The Risk Behaviors domain. This domain identifies the youth's engagement in high risk or concerning behaviors that put their safety at risk or makes them dangerous to others. The Strengths domain. This domain identifies any and all of the youth's potential strengths that may support them in times of distress. The Cultural Factors domain. This domain identifies the youth's needs related to difficulties stemming from the youth's identification to or with specific cultural groups or any distress that might occur due to membership to either dominant or non-dominant parts of society. The Caregiver Resources and Needs domain. This domain assesses any parents' or committed caregivers' identified strengths and needs. The Early Childhood domain. The Early Childhood domain captures all the domains previously mentioned, but reimagines those domains for children aged birth to age 5. The subdomains in the Early Childhood domain are Challenges, which is similar to the Behavioral Emotional Needs domain. Functioning, which is similar to the Life Functioning domain. Risk Behaviors and Factors, which is similar to the Risk Behaviors domain. Cultural Factors. Strengths. Dyadic Considerations, which is exclusive to the Early Childhood domain and speaks to the importance of attachment and assessing the child-caregiver relationship. And the final subdomain in the early childhood domain is the caregiver resources and needs subdomain. The final domain in the IPCANS is the traumatic adverse childhood experiences domain. This domain assesses the child or youth for any of the identified traumatic experiences. This domain is not rated on the 4-item rating scale. Rather, the response is a simple yes or no to the identified traumatic experience. Although there are 8 domains, not all 8 are used for every child. Depending on the age of the child, different domains will be used to assess that child and their family. For youth aged birth through age 5, one would use the early childhood domain and the traumatic adverse childhood experiences domain. For youth aged 6 through 21, one would use the behavioral emotional needs domain, the life functioning domain, the risk behaviors domain, the strengths domain, the cultural factors domain, the caregiver resources and needs domain, and the traumatic adverse childhood experiences domain. Best practice suggests that we complete the CANs with families by inviting them and their network into a conversation about each of the domains. Instead of going through the domains item by item, the CANs is best done as a conversation. It's all about collectively understanding and agreeing to what's working well, to what we are worried about, and to what needs to happen next. And that is the distinct beauty of the CANs assessment tool. Remember, the CANs is a communiometric tool that supports us in having a conversation with the family and their network. And at the core of it all is an opportunity for everyone at the table to have voice and choice and to build consensus around the child, youth, or family's identified needs and strengths. The CANs helps us to complete assessments with families, as opposed to completing assessments on families. And hopefully, with the family's thorough engagement and agreement in the process, we can help families create safety, permanence, and well-being for themselves after we exit their lives. For more information about the CANs or resources to support further learning, please refer to any of the websites listed below.